your confidence, your basic knowledge basically. So they basically
You
want
can mute the video.
whether you are
Yes, sir.
sorry.
Sir, hello. Congrats, Dr. Pankaj. Can you mute the video, sir? Video part. Can you hide the video or we can go with the video?
Okay, okay, sir.
Uh, yes.
Yeah, right, sir.
Congrats, Dr. Pankaj.
Good evening, Dr. Sabri.
Yes, sir. Good evening, sir. Congrats, Dr. Pankaj. We are happy for your success. Likewise.
Yeah, yeah. Thank you, sir. I know everybody has put a lot of effort. So,
Yeah, just keep happening. Yeah.
And for others to tell, Dr. Pankaj has been associated for quite a long time, Dr. From almost 1 year, right?
I think from February, I think, no?
Yeah, February.
February, yeah.
Part of our
Since
long
February, long course. Yes, sir.
dedicatedly practicing, in spite of knowing that the exams are not going to be there in June date. In India, we don't have the June date, right? So September. So he prepared right from February. And whenever we ask, give me whatever scenario, sir, I have to practice on the go. So that was the type of attitude Dr. Pankaj had. So I should be ready on any given day. So
Yes,
he,
sir. Yeah, sir. Whether I know or not, you have to practice that, and that only will bring out your drawbacks, and so that you can work on that. So very important to participate aggressively. That's what I felt.
so we are very proud, and mainly it's like expected results for someone who is preparing so hard, no? So it's an expected result, and that's the way what MRCPCH also the RCPCH examiners they also want that only that it should be like your daily way of life. So the way you exam, it should not be just for exams. So that's what Dr. Pankaj imbibed himself. It should be part of the day-to-day routine. So anytime you give the scenario, I'll be ready to present. So that is the thing which I liked about Dr. Pankaj. And you can start, Dr. Pankaj, how your stations, uh, how you approached. I think feedback also you got, so you can tell us more about the feedback also.
Yeah, sir. So basically, feedback I got only in two stations where I did not get full marks. Rest every station they did not comment anything that those areas are black, completely black. So I don't know what they like or what they did not like.
Okay.
So I don't know that. So how it went, I can tell.
Okay.
So my first station was it's a development. I started with development. So it was a 2 year old child. It was a girl child, and they asked that there is the child has grandmother was accompanying, and they have some concern about child's motor motor milestones. This was the only information that was given, and the task was to perform motor system examination. So history, I started like we do in our practice, the same pro forma. So I asked everything actually in the history, everything that was relevant. So there, the history. I mean, it started from 3 months of age. Before that, everything was fine, and 3 months of age, child had some abnormal movement, jerky movement, and from then they also reported this regression as well. So, so these two were important finding. Apart from that, child had seizure once at 6 months of age and probably at 9 months of age. So seizure was also there. So here, I think I asked everything like it. I thought that probably it is tuberous sclerosis. Sorry, it's infantile spasm. It looked like history looked like infantile spasm. So in the history, I asked everything like skin and family dynamics, why parents are not accompanying family known to social services, because it started at 3 months whether any child was dropped or any problem in the family parents. So I asked that those histories also. So in history, I don't think I missed. I completed the pro forma. But what happened with me with the development is that they gave the knock at 9 minutes. They did not give any knock at 6 minutes. So when they knocked, they told that it's 9 minutes. So at that time, I was slightly anxious. I asked the examiner again, is 9 minutes over, sir? He told, yeah, but he was also he was a bit, he taken aback. So he told, yeah. So I told clearly that, sir, I wanted to ask about the milestone, because I kept milestone for the last, so that I will ask in the last. Before that, I wanted to confirm, take history about everything, like social, family, consanguinity, and everything else. So I told clearly that I forgot. I wanted to ask, but now I did not have time. So he did not tell anything. They continue, and then he
But
after.
you were able to ask questions for the development or not?
No, 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 sir. This speech and social, I could not ask. Only
Okay.
one or two questions I was able to ask. Rest that was I was asking actually. So I told him that, sir, this part was left. I thought that I have time, so he did not say anything. And then he asked to summarize. What do you think? I told, and then he asked to examine. The examination was motor system. It was actually on examination. I did everything. Like we again did the pro forma, everything 4Ds. I wanted to check child's vision as well. I told examiner. I did not check actually. I told that is the vision okay? He told, yeah, vision is okay. In history also vision was, there was no problem with the vision. So I did not check, but I asked examiner. Then I selected the twice. Twice was kept in one uh, bag, carry bag kind of bag. So I had to. It was very difficult to yeah, separate and bring out. So I was a bit anxious at that time that, oh, I have to select. But then I collected and I started examination. Actually, nothing was. It was 6 to 9 months only. It came both gross motor and fine motor. So I asked, because child was not able to stand even. So I thought that is less than 12 months. So I did everything for 12 months. And then I had time. So I asked them, then I would like to do 180-degree flip test. Then he told that, okay, do. Then he gave me whatever in uh, supine, whatever in the vertical, ventral, and then prone. So it was coming 6 to 9 months only, because
Okay.
able to, yeah, because he was able to wear bait on 4 hours and sitting with the curved back.
Okay. So
So
so how was the marks? How much?
I got full marks, sir. I got full marks.
Okay.
And he, yeah, there was in this station also there was one comment that he could the knock came at 9 minutes straight away, so
So
the
he
candidate was not
recognized.
disadvantaged.
So he recognized the problem.
Yes, yes, sir, yes, sir. Because I raised that concern at that time only also. So he wrote that student finished the task despite the knock was given at 9 minutes, so he was not disadvantaged. He gave me full marks.
So I think here for the candidates, important take home I would say is one is maybe we should not keep the development assessment at the end, fag end, maybe a bit ahead of the social we can do, because sometimes it's not in our hand. If we miss out on the time, sometimes we might not be able to ask the development, and it's very crucial to know whether it is global delay or
Other
not. And unless we don't ask, we will not. And
able to know.
panic if there is a lapse from the organization and always raise the concern to the examiner. If the examiner is reasonably good, see, even if Dr. Pankaj didn't ask the social and language, still the examiner was ready to give the marks. Ideally, he should not have given marks because he didn't ask, but it is a problem
Yes, sir.
system, so he accepted and he gave. So we should not panic. So that is very important point, and try to bring the development ahead rather than keeping at the fag end. So that was one, and I think the trend is towards infant development, right? So we were guessing,
Yes, sir.
thinking. So they are
Yeah,
moving.
yeah,
Right, so slowly they are moving towards infant development, 6 months, 9 months. So prepare for that, and I think they are accepting the 180-degree flip. So I think you have to do that. Then that's another point to learn. Yeah,
yeah, yes, sir.
so you can.
Sir. So my second after this was history. So history, it was a 10-year-old girl. There was acute onset of swelling of right eye, and she was not able to open eye. This was the command. And take history from the mother, and then management planning. So it was very acute. So this in this case was acute case. 3-4 days swelling. There was fever, and there was history of allergy to grass wood or grass weed, something allergy, and family history of allergy was positive. So these were the only concern, and there was pain, not able to open the eyes, eye movement. Mother could not say. The problem with vision, previous there is no problem in any vision. So in the history again, I followed the pro forma. I tried to ask everything. I tried to ask even about insect bite, any trauma, weight loss. I mean those flaws thing, fever, weight loss, appetite, any lumps, bumps, sleep, all those things to rule out any malignancy or bad DD. Uh, so in the history, I got what fever, swelling, not able to open eyes, pain, allergy to some grass, family history of allergy, and mother's concern was that when I asked, so her concern was whether she will be able to see or not, how will be her vision. So all these areas I explored. So I don't think anything I missed, any major thing I missed in the history part. So in the discussion also, he asked me about, first he asked me what are your provisional diagnoses. So I told those orbital cellulitis, preseptal cellulitis, conjunctivitis, trauma, insect bite, and tumor. So these were my main DDs. So he told me that what do you think is the cause here? I told that maybe he is allergic, so there may be allergic sinusitis, and that may lead to this. So then he asked me about investigation. What investigation you would like to do? So I started with all those full blood count, culture, swab, and also imaging. Like because child is not able to open eyes, so I would like to do CT scan as well, and to rule out any orbital cellulitis and also any sinusitis. So these were, I think, were the gist of this. He asked me, "Do you want to do MRI of brain?" I told that in the history I did not get any finding of CNS finding. So, but I would like to consider after consulting with the senior, and I involved ENT and ophthalmologist both. So he asked me why ENT. So I told that there is a possibility of sinusitis. So ENT should also be involved. He did not say anything. Then what? How will you counsel the mother? What would you like to say to the mother? I told that, sir, because I don't know what exactly is going on, so I would uh, tell mother. I would like to reassure mother, but uh, with some pauses that we will assess with the CT and if need MRI, and then we can tell you about what's going on, how is the prognosis, and also we will consult the ophthalmologist, eye doctor, uh, and then we'll decide about that. So he did not say anything. He was very quite neutral, kind. His teacher means expressions were uh, none actually. I could not judge how he is feeling at that time, but he gave me full marks.
Okay. So sometimes examiners are bland, so they don't nod.
Yeah.
We don't know whether he's whether we are saying it correct or not. If they nod the head, at least we know that we are going in the right track. So,
Yeah, he asked me about whether it is serious or not. I told that, sir, it's because the eye movement cannot be assessed. So at this point, it's very difficult to say. But I think CT will guide uh, in uh, how serious it is in making out.
how many questions were from the guideline, doctor? So there were a lot of questions from orbital cellulitis guideline.
Like, sir, I means management wise, they did not ask about any antibiotic or means name of the antibiotic.
Okay.
They did not ask how many durations. These things he did not ask. He asked me about how will you counsel mother, how whether it is serious or not, uh, and who are the team you will involve, and whether MRI will be done or not. All those things he asked, but from guideline, duration of antibiotic, what antibiotic, they were. He was not into that.
Okay. Okay. So I think it's like it's a acute problem, and you have to prepare your differential diagnosis and ask questions. So try to elaborate on the history, and there is a diversion there. I think so. They are whether you are thinking in terms of allergic cause or not,
Uh,
whether you are
yeah.
working away from that and thinking in terms of orbital cellulitis and malignancy. I think so. That is the whole crux there, and maybe they might be having a lot of questions packed in the orbital cellulitis.
Yes, sir.
So,
He
and
asked me about complications. He asked me about complications. I told about this involvement of nearby cellulitis, involvement of brain and CNS involvement. He asked me anything else. Then did not. I could not recall anything else. Probably he was asking. He was wanting, I think, cavernous sinus thrombosis or something like that. I don't know, but I could not say at that time.
okay, okay, okay. I think we have Dr. Belvina also joined here. Good evening, doctor.
Good evening, sir. Hi.
Congrats, ma.
Congratulations, Dr. Belvina.
Thank you, sir.
Okay, ma. So we were going through. So maybe you can share quickly the development and history, and we can go randomly. Uh, how was your history and development?
Sir, I actually gave exam on the same day as Dr. Pankaj.
Okay, so then it would be
Yeah.
easier. So
Yeah.
he
I was.
told all
I,
the scenarios actually. So any difficulties you faced in the infantile spasm child in getting the developmental age?
yes, sir. Actually, that was the problem for me. I got only 8 marks in development out of 12. So what he has told us, for me it was difficult. My mind was over 2 years. So I was asking questions from 1 to 2 year. That age group I was asking. So maybe it was because of the tension or something. I totally forgot about that infant assessment. So I
Yeah.
was like, when it came to 1 year, I got stuck. I was like, what else will I ask? then only I came to realize this gross motor infant assessment is there. So by towards the end only I was able to ask infant gross motor assessment. From that,
That is
I
the whole crux, right? So they are moving towards the infant assessment and they are expecting you to do the infant assessment. Maybe that might be the reason. And
yes,
in the remarks also, he has written that only.
yes, in remarks he has written that, and in my mind I was thinking I told assessment the developmental age of 6 months, but he has written I told 6 weeks, 4 months, something like that. So even I don't even right now I don't remember what I told. Maybe because of the tension I don't know if I have told 6 weeks or something, but my mind was 6 months, but he has written 6 weeks, 4 months.
Okay. Sometimes in the slip of the tongue, so that's why one suggestion is maybe try to tell each milestone their age, and then finally say overall age, so that we don't make a huge mistake. Sometimes we tell just a single age, we might miss like this. So whenever you are looking, how is the child holding the cue, crayon, scissor, tell each one by one what is the expected age and overall what is the age. By doing that, maybe the examiner might be convinced, okay, you're talking about 6 months only, like that.
Yeah. Yes, sir.
The history, doctor?
History was orbital cellulitis that I got full mark. That was okay only because initially itself she started telling child had pain on left eye, then that swelling came, he had fever. So I started asking questions about complications, and all those things were covered in the history itself. Then examination he was asking, I think it was exactly as per the orbital cellulitis guidelines he was asking. He asked me complications. So I told cavernous sinus thrombosis, but again he kept on asking what all complications you can expect. So that I was not able to tell. I think he was expecting endophthalmitis. I don't know.
Yeah. So I think if it is in the guideline, so many questions you can expect to come from the guidelines, because these history and development are framed straight from the RCPCH. So exactly what questions need to be asked, what is expected out of the candidate, everything will be written and coming as a script. So yeah.
Yes.
Okay. Dr. Pankaj, next we'll move on to the next station.
Next my was communication.
Okay. I think Dr. Geetmala ma'am, are you there?
Hi, sir. Yes, please.
Ma'am can lead the communication.
So it was it was a child. I think I don't remember the age. 5 6 years old child, I think. So was admitted with viral V's and improved with back-to-back nebulizations. And he was given peanut butter while it was written in the file that he is allergic to peanut. So it was given by somebody from food and beverages. So you have to talk to the mother. He developed hives which subsided with the antihistaminics. This was the stain. So now
Okay.
you have to talk to mother and address her concerns. So in my case, mother was very angry. So I started with the same pro forma, like greeting and asking about attendant, asking about her no prior knowledge. So after all those things, I told her that this has happened. So she was very angry. Who did this? I want to know who has done this. So I addressed that in our way that this is a responsibility of everyone. So we are looking into that, but it's not any one person's fault. So I tried to calm her down. After sincerely, I mean, I apologized sincerely and ensuring that he is now okay.
Hello.
So, hello, hello,
Yeah, continue, doctor.
Hello.
Continue.
Yeah, so I sincerely apologized and then saying that the child is okay now. I discussed with her about that we have started.
What is the previous value?
So we started the incident form and doing
Okay.
root cause
Some other
analysis.
GDM.
Yeah, continue.
So mother was asking about here while I was explaining her, she asked suddenly about EpiPen. So she asked suddenly that it's my fault that I did not keep the EpiPen. So she was blaming herself. So I told that no, he's in the hospital and we are doing. He has given medicine and he's now completely okay. But yeah, uh, you should keep EpiPen with you all the time with the person who is accompanying the child and maybe possibly in the school or wherever he goes regularly. You need to keep two EpiPen. So these were the mainly areas uh, where mother I talked to mother. She asked me about EpiPen mainly apart from other things, root cause analysis and all those things. She asked specifically to me about EpiPen, and I explained to her about that. And I told her that, and we will also arrange a meeting so that the use of EpiPen can be explained to you again if you have any doubt. And at the end also I apologized. Here important thing is that in the flow it was going like that, means pace was moderate, so I did not get time to summarize. But still they gave me full marks. And
So I think, summarize is not a important component as long as it's more question is how you are going to react, how you are going to respond. Yeah, I think madam can tell.
Yeah, well done, Pankaj, on getting full mark. I'm very proud of you, first of all. And as all of us would expect, one would be information giving, and another is usually a difficult case scenario. This comes under a difficult case scenario where you tend to attend to an angry mom. But here, I think
mm,
most mark comes when you keep yourself calm and give adequate information and be sincerely apologetic. I think you have done that rightly. That's why you've got enough marks. And I think here they were trying to cover both aspects, isn't it? You're trying to apologize, reassure the child that the child was doing fine, just having these, not gone into anaphylaxis. And also, when mom talks about EpiPen, I think that's the right moment for us to catch and say that she's being very keen or she knows how to treat allergy because she can actually pick up that it is an allergy and she's talking about EpiPen. You can appreciate her and
yeah.
take that as her presence of mind. So all those are the communication skills. And rightly, as you said, you'll have to talk about incident form, pulse, if needed. And I think, yeah, you've ticked all the box needed. You don't have to summarize as far as you gauge the situation well, communicate well. And finally, you have directed. So you have the next plan, like the incident form, the investigation going on, you have apologized. So that completes the station. You don't have to worry about summarizing. Summarizing here would be very minimal, isn't it? You're just going to, again, at the end say you're going to be sorry, and then probably will look into what has happened and then learn from the incident and never make sure this might not happen in
Whatever.
future. Take
Okay.
steps. That's it. Yeah. So perfect. Yeah.
Yes.
And Dr. Belvina, you did anything? You had
Same
any?
thing for me, sir. The same question came for me. First communication was viral allergic V's. So the same thing. So there I received only 5 mark. What the examiner has written is inaccurate information about viral allergic asthma need to involve lung doctors to do tests to say whether this is asthma. She kept on asking whether it was asthma, but I remember I told we have to involve lung doctor, but the examiner has written this way. And in E2, the examiner had written no discussion about complaints procedure. so I didn't understand what it was. She even asked me about EpiPen and all. So I told you have to keep with you, like that I told. But that station was not very good for me because it was immediately after the development station. So that was I was very much tense because I was not able to come to a proper diagnosis after the development station. So my mind was somewhere else. So that communication station was not very good for me.
I think the baggage here we keep saying, no,
Yeah.
Yeah.
the baggage of one station will affect the performance in the other station. However,
Yeah,
Yeah.
don't carry it.
simple, however,
Yes, during that 4 minutes time, I kept telling on myself there is no use worrying about the development station. It's already gone. But
but it
um,
keeps coming. It keeps
yeah,
coming.
it kept on coming. Yeah.
It's there, but try as much as try consciously to
Yeah,
stop.
I think for communication, you have to have a complete calm mind. Otherwise, you will keep on blabbering something else. Like you need to be focused as per how the candidate is, the other person is reacting. So my candidate was extremely angry, she because of this allergy issue.
And next station, Dr. Pankaj.
Next communication was again, it was DDH was diagnosed at 8 months. The stem was like 8-month-old child, now diagnosed with DDH. Mother claims that she already told when the child was born that somebody in the family has this hip dysplasia, but no tests were done on 2 occasions. No tests were done, and on the examination was normal. So now diagnosed as DDH at 8 months. Talk to the mother and address her concern. So here again, I mean, when I was outside, I was thinking whether a relative has been mentioned, but what relative, where first degree relative or whatever.
It was
Uh,
actually the father.
no, so that mother told na. So when communication started, so
Mm-hmm.
I mean I started uh, uh, the flow like we do, like a greeting and attendant and prior knowledge, all those things. Then I told that this is how she is diagnosed now is diagnosed as DDH. Do you have any idea about this? Have you heard about this? Then she started telling that doctor, now she is limping before my eyes, and I was telling when she was born, I told that she told the father is having hip dysplasia. Now, here I did not ask her whether your father or the kid's father had this. But I told that yeah, sometimes it happened. At that time, I explained like that only, that this is we call it developmental dysplasia. So this sometimes develop later on. Initially, there is nothing. That's why this is called developmental dysplasia of hip. I explained like that. Then she was still insisting on that doctor, this is I want to raise about this issue. I would like to complain because no attention was paid to uh, my history. Then what is the need for taking so much of history and doing all those things? So at that time, I told her that I can understand your concern. I know that you might be very upset, and I will look into that what happened at that time when she was born, why it was not done. I will talk to my consultant about this. I will discuss it with my consultant. But if you allow me, do you want me to know about this hip dysplasia? Then I can draw a diagram and tell you about this. So surprisingly, she told, "Okay, doctor." so that was a great relief for me. So I explained. I already drew the diagram. I explained her about this. Then she came on this treatment part. So then I told that treatment, actually at this point she will need operation, and but I am not the best person for that. We will involve the bone doctor, and the thing they will decide how to go. Then she also asked me about how long she needs to stay in the hospital. I told that see, I cannot give you any timeline because it depends on the investigation finding and how severe it is, and that will be decided only by the bone doctor. So I can't give you any timeline. So that way, it I mean, it went on. It was actually, again, I could not summarize because this was going on about admission, investigation, and how long it will take. Uh, so I could not summarize in the. So I said sorry two times in the beginning and in the last also, that I'm sorry for your child, whatever the name was. Then time was over. I said thank you, and I again got full marks. I don't know how.
I think the major mark is how you are interacting, how you are building the rapport. So those communication aspects, they look like.
Yeah, I think keeping your calm, whatever mother says, you just keep your calm and wait for some time and then start talking. That helps, I think.
Dr. Geet Malaman, you want to add it?
Yeah, as we always say in the class, communication is not about completing the station, isn't it? How well you conduct yourself, the interview, that gives you more marks than giving it a completion, because the role player's role is completely different. They might have concern. As far as you make it as a two-way conversation, it's perfect. Like if they ask some question, you address it. Sometimes we are so much obsessed about the diagnosis outside. Sometimes we are only talking about developmental dysplasia of hip, which might not fetch enough marks because you're not addressing the concerns. So if they have a specific concern, you address it, and if you still don't complete the station, you will still get full mark. That is the beauty of doing a communication station. But as said, like both the stations look very similar. It is again a mistake, isn't
Yes.
it? In UK, just for everybody to know, there is something called as NIPE that is done for babies when they are born. That is called Neonatal and Infant Physical Examination Program, which is invariably done for all the babies born in UK. So one part of it is to diagnose the developmental dysplasia of hip. Because if they are diagnosed before 6 months, the treatment is different. If they're diagnosed after 6 months, it is surgery. So here, what we understand from this scenario is there has been a huge lag because there is a family history of positive family history, and which warrants a 4 to 6 week ultrasound scan, earliest scan
Yeah.
for them to diagnose, isn't it? So this is again a mistake from our side. So as far as you apologize, reassure this needs an investigation as well. Where they missed, was it the primary health or anything? That incident form again comes into a role here. If the patient wants to uh, complain, you should facilitate for pulse and all those complaint process. Otherwise, it's only the communication. Have some background knowledge. This is a mistake in UK, I would say. So if the child is born in UK, not diagnosed with developmental dysplasia of hip with a family history, that is a huge lack on our part as doctors. So probably that is why this scenario has come. So as far as you understand, it's your responsibility, and then carry forward with your communication. It should be fine.
Yeah. Yeah. So I at that time I apologized for both, for father and for the child as well. And I told that I
Yeah,
will. I don't know what happened at that time, but definitely I will look into that and I will also discuss it with my consultant.
yeah.
I don't remember whether I said about the incident form or not,
Instant
but
form. Yeah. That's something because we are not very sure what is happening. That's why I mentioned about NIPE and other stuff. This is another scenario which does warrant an incident form because there seems to have been a masking of the information that the mother has given. So that needs an investigation in the background. But here it's again apologizing, reassuring, and if they want to complain, facilitating them for the complaint process. Yeah. Otherwise, I think you've done it beautifully. You've talked about the surgery more than the Pavlik harness and all those things. That is what exactly happens after 6 months. So I think you've done it very well.
Dr. Pelvina?
That station was okay for me, sir. I think I remember the the person kept on asking me why it was missed. So even when I tried to dodge the question, she kept on going back why it was missed. So she was kind of angry that it was missed. And in the beginning itself, I asked whether she wants to know about developmental dysplasia of hip. Then I started drawing and I explained it. So there and all that was okay. Then she told, yeah, my husband is also having the same issue. Why it was missed like that? She kept on asking. So I told, I'm really sorry. Sometimes these kind of things can happen, but I'm really sorry this has happened. So that he has written specifically. You are not supposed to. I am unsatisfied with why you have told these kind of things can happen like that. The examiner has written in my remarks.
So what the examiner was expecting, Doctor?
I don't know. He has written. I was not fully satisfied with your explanation that these mistakes can happen, and I'm really sorry for that. Uh, he uh, he he has written more empathy. Mhm.
Maybe I think more than sorry, as Dr. Gitmala was saying, they were expecting
Yeah,
to say apology.
yeah. Yeah, exactly. That was my point, because sometimes what we tend to say is this can
Mm,
sometimes happen. It
mm,
comes out of
mm,
our
mm,
mind. Like sometimes this does happen. So, but
mm,
this
mm.
shouldn't happen, isn't it? That's why there is a system called NIP. They don't want to miss
Yeah,
such a thing, which can be treated early if diagnosed early. So this is a major lag on our side. So that is what they are trying
we
to
have to accept.
see. Yeah. So if you say this can sometimes happen, it reflects as if we are okay with the diagnosis being diagnosed late. Do you understand? Yeah,
Yeah.
probably that maybe that is what the examiner is meaning by this
Mm,
can
mm,
sometimes happen. So that comment means it should never happen. Sorry, it has happened. It shouldn't have happened. So that is what they are expecting you to say.
mm, mm.
Okay, Dr. Sabri has to say. Let's put some. Hello. Okay, so Dr. Pankaj, we can move on to the next.
Yeah, so my fifth station was video station. So first video was 5 or 6 years old boy who was coughing. Cough was like barking type of cough. So it looked like croup with mild to moderate, not very severe. So mild croup without any cyanosis or there was. I think I told that. So I explained about the video and I told the finding and I told that probably there is a strider because it was not very obvious in the video to me, but I felt that there is some sound, inspiratory sound is there. So I gave DDA according to group only. All those DDs acute. Basically acute thing only. I told that it looks like acute, so acute thing I told. But if chronic, I would like to consider. So he told that okay, no need. So it is acute. So what are you going to do? I means what history you would like to ask and what examination. So I don't think there is much to say because it's a very common scenario group. We ask all those things, onset, course, duration, apnea, cyanosis, feeding, dehydration, anterior fontanelle, urine output, house feeding, vaccination. So it was very typical of uh, group video station, and I finished it before time actually. Typical, I specifically mentioned about no investigation in more louder word. No investigation. He asked me what investigation you would like to do. I told that usually in group we don't do any investigation unless there is any focal finding or any other concern. And then the investigation and in management I mentioned about observation for 4 hours, and then taking decision about further care, and then analgesia, hydration, and steroid, one dose here, and maybe if discharged, then another dose within 24 hours of prednisolone. Then I kept on telling about if it gets severe, then we will admit the child. We will involve PICU, anesthesiologist, ENT, and yeah. So I told everything in one flow about management. So it finished before time. We were both looking into each other, and for almost 1 minute, I guess. If not 1 minute, then 40 seconds.
Yeah, yeah,
I got full marks here.
yeah. Many times it happens in a video station. It gets over early. And I think Dr. Sabri can lead the video stations a little bit.
I think whatever thing uh, for the respiratory system, the sound for noisy breathing, I think most of the times it is they are expecting the acute history only in video station. So if you have discussed the points for the history, reading on to the etiology or the complications, and then discuss about the management. And rightly, you have mentioned it's a clinical diagnosis and other things like management of steroids. You can just stick on to the guidelines, so that will help in
Yeah,
the station. I think this is repeated multiple times. I think video is one session where we can just for last minute trading, we can focus on the repeats and be able to get through that session.
So it's a basic concept is it will be an acute emergency case they will be keeping. And if it is in the guideline, so most of the questions will be from the guideline. And we
Guidelines.
should have the courage to say no investigations. So,
yeah,
so I think so whether you are a safe doctor or not, so no point in a child with a stridor taking and going for the X-ray because we have heard of steeple sign and all, no. So we'll be fascinated to tell. Then we might get less marks if we do those things. So, as in the guideline, no investigation. Do not disturb the child. It's very important.
yeah. Yeah. That I also mentioned. Yeah, do not disturb. Right.
Dr. Belvina.
Yes, sir. Same thing here. That station was actually okay because we had practiced many times the same one. I received the same one as well. So I think she was expecting me to tell. She asked me what investigation you want to do. I said no investigation. So that was a happy note. So I was sure I will get full mark. So I received full mark there. So that was okay, sir. The same thing, like just she was asking exactly the guidelines for group.
So I think here everyone should take a note of preparing for the guidelines. So history was from the guideline orbital cellulitis, and now one group has come straight from the guidelines. Okay, okay, Dr. Pankaj, next video.
Yes, yes. So my second video was it was extreme preterm baby, which was covered, and one stethoscope was kept. I think those stethoscope, advanced stethoscope with the sound which audible, and the murmur was more pronounced in the right upper quadrant, and it was continuous and machinery kind of murmur. So this was basically a PDA murmur. So I explained and I told that this looks like a PDA murmur. Asked me about DD. So I told that, sir, considering this is premature, most likely it's PDA, and I don't see any marks, if there is any uh, surgical scar, then I would like to consider those shunt murmur, but it's very less likely at this age. And then ask about PDA, what in examination you would like to do, what in the history, what would you like to ask, and then how will you manage. It was standard of PDA actually. And the video was like child was completely covered. It was told written that it is extreme preterm baby, and this was being performed. The auscultation was being performed, and sound was audible. and there was no any monitor, no saturation, nothing was visible there. Child's face was there, and it did not look cyanotic. So I mentioned all those things, whatever I have seen, and that is not looking like cyanotic. Child is pink, active, and is covered. No saturation or no monitor is attached. And then discussion went for PDA. One specific thing he asked me is, do you think the medical management will work? I told that considering extreme prematurity, it's a good chance of closing with the medical management. If not once, then the second attempt can be given, and usually works for a preterm, while in term baby, it's less likely to work.
So again, it's a emergency, I would say. Preterm, duct-dependent lesions. So,
Yeah.
it's a very important emergency, and
Yeah.
it's
So
from the neonatal guideline. I think we have to also prepare some neonatal guidelines also.
yeah, now it's a trend. Like one neonatal video, I think is mostly they are
Yeah,
giving.
I was about to say that. So I think one
Yes.
newborn they are keeping. I think recently
Yeah.
we had a CP uh, baby,
HI,
HI.
then conjunctivitis,
Now
now PDA,
neonatal alloimmune thrombocytopenia.
thrombocytopenia.
I
Yeah.
think one station is newborn
Mm.
so far recently. Yeah,
I also mentioned about bounding pulse in the examination. So here also I got full marks,
very good. Very good.
and it was also completed before time.
Yeah, and Dr. Belvina.
Same question, sir. After I told her about medical management, she kept on asking me about what if the PDA does not close after medical management. So I said we'll follow up, and uh, then she asked, when will you do surgical closure for the PDA? If the PDA is persisting even after discharge, when will you do surgical closure? So that question was kind of unexpected for me. I didn't know what to tell, because I told we'll involve the cardiology doctor, and after his opinion we'll discuss. So that I think that didn't go well. So she has specifically written. I was confused when to do the surgical closure for PDA. So I think
I
it was clearly written in the guidelines. We have to do even if the PDA is open after 1 year. So that I didn't know. So that she kept on asking. I
She asked
think.
me also.
Hmm.
He
So
asked me this
there,
question also.
yeah, there I lost 2 marks, I think.
Oh, I mentioned
Hmm.
that I will involve
Like,
cardiologist regarding that, but hemodynamic, I will also look for hemodynamic stability of the child, and probably that will be dependent on the child's hemodynamic status,
yeah,
and we can consider.
when I saw the preterm baby, I was like, it was the last station for me. So I was like very happy because I'm already doing this fellowship, and I'm like, oh, I'll be able to answer everything. So when it came to PDA, whatever I know, told, but she kept on asking the particular guidelines. So unless you have gone through the guidelines, you'll be able to tell. But I didn't go through the neonatology guidelines, because already the pediatric guidelines were there were a lot to read,
So
so I
so
missed
much
it.
actually. Yeah. So that's what. So even if we prepare from something else, the questions will be from the guidelines. So we might be marked down if we tell from other sources. Yeah. Okay.
Maybe one thing is the guidelines part. Whoever is reading guidelines, like the next people who are going to the exams, you can just look at the flow chart rather than looking at the fine details of the guidelines. You can just see what is the step one, step two, like that. So that they are more focused on the overall picture of management
Approach.
rather than any fine details. So from that will help. And in any scenario, even if you don't know the answer, like Dr. Pankaj said, depends upon the hemodynamic stability or the child is thriving well or not. So maybe these sentences will try to patch up you if you don't know the exact answer. So it's better to say some generic statement rather than outrightly saying I don't know. Maybe that would have helped Dr. Pankaj in getting the diploma.
So, clinical stations.
Yes, sir.
So,
Clinical is my.
we have Dr. Gopakumar here. I think he can also share with us with the clinicals. Good evening, Dr. Gopakumar.
Good evening, sir. Good evening.
Congrats. First of all, congrats.
Thank you, sir. Thank you, sir.
We're happy for you.
I'm extremely happy, sir. I'm excited, in
Congrats,
fact.
Doctor. Congrats.
Thank you, sir.
And Gopakumar has a mystery with him. He is a very sincere listener, I would say. He had been listening to all and practicing, and so that's very important to listen and practice. He was very confident that way. So very happy for you, Dr. Gopal. We
Thank you, sir.
started
Thank
with
you.
our development rapid revision and
Yes, sir.
joined.
Yeah. Initially, one of my colleagues, Dr. Jawahara, she actually motivated me to do MRCPCH. Initially, the first part, the second part, and third part. Also, during this session, before the third part, my HOD had asked me to attend some contact session, and hence I happened to join Smart Academy course, and there only I met Sir Balaji sir. Sir had come there, and I had met you. And finally, only after 1 year, I got a slot. And in between, there was a developmental workshop session. That's when I joined the target group. I didn't join for the long course. So I finished the development. Development was one of the toughest parts for me. Developmental history, developmental assessment. And Balaji sir, not to mention, he's an expert in putting forward how development history assessment has to be done. He has a beautiful format. You just mug up the format. You can just walk through. My
Yeah.
development station, I was very happy because initially Sir had taken a revision series on videos. So in that station, some candidates were saying had they got clinical stations first, it would be nice. I thought, no, it's not possible for everyone to get clinical stations because it's a circuit basically. But then I also thought maybe if I got development as a first station, it would be nice, but I cannot wish for more. But thankfully, on that particular day, development was the first station for me. And I was extremely happy that I could do it well, but I was not sure if how much marks I would grab, but I got full marks for development. Thank you, sir.
Thank you.
And then I joined the intensive training program for 2 months. I also wanted to participate actively, but then most of the candidates had joined for the long course. They were extremely confident. Seeing at that confidence, I thought I'd join. I would actively participate after 1 month. But after 1 month, I thought maybe if I participate now, I will lose my confidence. So I thought I'll continue so. And Geethamala madam, everyone was very supportive. Sabri sir, he was very precise, he's very concise, up to the point. And Murtasa sir, and not to mention Geethamala madam, her communication stations were very effective. She the one of her classes, she told she also was a passive listener. I don't know if she bluffed or not, but that indeed helped me because I was also a passive listener. And during the last 2 weeks, one of her videos, she told, um, it's okay, be relaxed and all. I was in fact panicked that I didn't develop any exam fever. Then after hearing that Geeta madam saying that don't panic, just be calm and all, I became even more relaxed. So that the support part was very good. Even though I was a passive listener, the support from the target group was really good. And that's so I was not very confident and all, but I don't know why sir said so. I was not very confident, but I wanted to pass that magical number, but eventually I got more than that. Thank you, sir.
Thank you, Dr. Gopakumar.
Yes.
Thank
Okay,
you for mentioning me, Gopakumar. That's very kind. I think I can see myself in you, a bit of myself, unless I am being asked. with my name. I don't generally answer, but I am very active listener. I do listen. I take notes. That does help because everybody's way or your mode of communication to others is different. Some of them are very open. Some of them are little closed. You need more thing to come out. But you did very well and fared very well. I'm very happy for you.
Thank you so much, ma'am.
Well
In
done,
fact,
ma'am.
you have motivated me more during
Thank you. Thank you.
competition sessions. Thank you so much, ma'am. Because
Thank
at
you.
the end
So
of the
glad.
day, what I feel is it's not about how much time that you spend, it's the quality of the time that you spend which
Yeah,
matters.
exactly. Well done.
Thank you.
Okay, Dr. Pankaj, we'll continue the clinical stations. Maybe all three of you can answer it. And Dr. Gopkumar, you did on the same day as Pankaj and Palvina, or?
I did on 7, sir. Belvin, I think did on 6th. But
Okay.
I did on 7. I don't know about 7.
Second.
Okay.
I the first day. First day, first serve.
First day. Well, okay. Second day, first session. Me.
Okay.
Myself,
Okay.
first day, second session.
Okay, then maybe we'll finish off the clinical stations and hear from Gopakumar. Dr. Pankaj, how
Yes,
were
sir.
your clinical stations? Maybe short gist.
Yes,
Because
sir. Yes, sir.
clinical stations, I think it is the examiner's choice.
Yeah.
So
Yes, yes.
every examiner have their own way of assessing and
Interpreting. Yeah. Yes, sir. I
interpreting.
felt. Okay, so I will start. So first station was my CVS, a 6-year-old girl. She had a median sternotomy scar. Scar was well healed, but still looking fresh. I mean, pink and pink kind, and it was slightly raised. There was clubbing, but there was no obvious cyanosis, and there was one pansystolic murmur, which was most prominent in left lower sternal edge. So I capitulated everything, and I told whatever I found. I told that there is clubbing. The wound is not very old, but it has healed well. So I think I would like to check for oxygen saturation because cyanosis is not obvious, but there is clubbing. So I gave blanket diagnosis of complex congenital heart disease. I did not tell anything with this residual MR murmur. Most probably this is cyanotic. Probably looks like cyanotic congenital heart disease because clubbing is there. Uh, and uh, and then they asked me question about what thing you can think of. I told that I can think of tetralogy of Fowler. Uh, that only one thing that I told, and I told that other for pansystolic murmur in the left lower sternal edge. I told that I would consider VSD, but not in this child because the child has already undergone open heart surgery and tricuspid regurgitation. Only these 3 or 4 DD I gave. I did not mention at that time about rheumatic fever or anything else. I only this uh, DDs I gave, and management according to complex cyanotic congenital heart disease, which was operated. I mentioned about infective endocarditis and I mean complication and for residual murmur about advice to the parents and involving cardiologists and all those investigations. So it was typical of that. I got full marks in this with this flow.
Okay, next.
So my second was this was abdomen. I think it was 15-year-old girl, 14 or 15-year-old girl. I was asked to do general examination and relevant exam. But in my feedback, it's written it was abdominal examination. Yeah, and the background history was given that the child had jaundice in the neonatal period and had gone some procedure. So examined. So after doing quick general examination, I did abdominal examination. Here, to make note is that she was 14 or 15-year-old girl, so she was hesitant to lift the t-shirt. So mother was there. So I asked mother, "Can you help me?" So she lifted a bit up, not completely. So I told that it will be good if you lift slightly more if you feel comfortable. Then only the child lifted, and that time I saw the this liver transplant scar, Mercedes-Benz scar. And then there was liver around 3 or 4 centimeters, and the spleen was again around 4 centimeters of spleen was palpable. So I gave a diagnosis of post liver transplant status with hepatosplenomegaly, probably some neonatal diagnosis like biliary atresia.
Okay. So any comments they have given?
Yeah. Here I got 6 marks. So he commented that what was the comment in this abdomen? He wrote that I did not give complete investigation. I did not. I did not mention about blood investigation. I mentioned about upper GI endoscopy only. He asked some question about portal hypertension. Then probably I did not mention any blood investigation. I mentioned about upper GI endoscopy. That was the only comment that was given in the feedback.
Okay. I think here one is exposure. So be gentle,
Yeah.
but try to expose the abdomen. Otherwise, we would have missed the star. Hmm. And
Yes, that's
look into the center also before going to the exam. What specialty is there? So here, I think it was Rela Institute where
yeah.
so the hepatic liver transplant center is there. So we should adapt ourselves, look into the center, what type of cases might come. Some idea will always help. Otherwise, you will be taken by surprise to see suddenly a liver transplant scar. Okay, next stations, doctor.
My next session was it was CNS. I think 11 or 12-year-old girl asked to do lower limb examination. So on examination on talking, she was submental, moderate. I would say mildly submental. Speech was kind of not completely clear. I won't say dysarthric, but it was not completely clear as well. So I started with the. I wanted to see the child standing. So I asked to stand. The child, she stood. There was contracture at the ankle joint and at the knee joint as well. And I asked to examine back. Again, the child refused straight away. No back examination. I told the examiner that she is not allowing to examine the back, so I would like to go for gait. So I assessed the gait, and it was like what is spastic kind of gait. So that, and then I did the lower limb examination. Child was supine, and then I did examination. It was lower upper motor neuron type of finding. I did systematically examination. I did systematically. I checked because reflex were brisk, so I checked clonus as well, and then I moved to upper limb examination. And the finding was that they asked me what are your findings. So I told that upper motor neuron finding in all 4 limbs, but it's not equal in all 4 limbs. So I would like to give quadriplegic CP as my first differential diagnosis. Then he directly asked me question that why this stone is different in uh, all limbs. So then I told that maybe child is having physiotherapy or some kind of medication for contracture. That's why the difference in the tone. And then the management went according to the CP, all those multidisciplinary team involvement of all the specialties I mentioned. And I would say it went very good, and they gave me full marks in this. So there was no comment. Only thing I forgot was the plantar. But still, I got full mark. I don't know. I was lucky.
Yeah, the plant. So be systematic in CNS. So make sure you don't miss the bulk, the tone, power, reflexes, plantar. Yeah. And we have to keep seeing cases. I think that is the key for clinical stations.
Yes, sir.
At least practice on normal cases, at least the format, if we don't see regularly cases. Because in that 5 minutes time, doing will be very tough if we don't practice. I think that is important. Yeah. Next, others, doctor.
Our last station was again a 14-year-old male child who was dysmorphic. Clear cut, it looks like it was mucopolysaccharidosis. So my command was to do the general examination and look at the abdomen. In feedback, it is written again as abdominal examination, abdominal station. So I had two abdominal station if we go by feedback. So on the general examination, I did head to toe examination after doing the hand examination, and I think I did well. So far, only thing that I missed was the ear. I did not examine ear. Otherwise, I examined eye. There was no clouding. I mentioned that oral hygiene was not good. I mentioned that child had pubertal changes like hair in the mustache area. So pubertal changes, those things I mentioned. I mentioned about I would like to check about anthropometry and pubertal assessment. Then abdomen, there was hepatosplenomegaly, which was moderate in size. I checked back also. There was kyphosis, scoliosis. I mentioned, but I don't know. I did not get. I get again here 6 marks. And comment was actually DD. Yeah, DD. We did not give DDs. I mean, maybe because I was preoccupied with the mucopolysaccharidosis, I only gave storage disorder as my DD. I think I did not mention about the causes of hepatosplenomegaly, other causes of hepatosplenomegaly, and that there was something in the ear. They told that there is ear discharge. Did you see? I told no, sir. I did not see that. So maybe because of that, they did not give me full mark.
4 marks reduced, doctor. Then details.
Yes, sir.
78. 78, right?
Yes, sir.
That's a great achievement, doctor. 78 out of 82. I'm proud of you. Dr. Belvina, your clinical stations?
Mine was first one was adolescent girl. She was 13 and she was having a midline sternotomy scar. She had no clubbing or cyanosis and she was normal for her age. So I auscultated. I was able to hear a murmur on the uh, left lower sternal as well as the pulmonary area. So I told I'm able to hear a murmur over the precordium, more in the pulmonary and sternal area. Systolic type, I told. But I think from the assessment, they have written she missed diastolic murmur. And my DDs were complex cyanotic congenital heart disease or probably a case of surgically corrected VSD or TOF with residual murmur. And he kept on asking the complications. That all I told in the thinking it as a TOF, I told the complications and all, infective endocarditis, all those things I said. So that station was quite confusing for me because I was not able to tell whether it was TOF or whether it was a surgically corrected VSD. So that was quite confusing for me. Then even kept on asking me for more DDs. So that also quite confused me. I said it could be rheumatic heart disease, something like that I told. So I got 6 marks over there.
The comments, what did he say? Okay.
He has written could not identify diastolic murmur. Then said positive murmur best heard in the left lower sternal and pulmonary area. Could have checked more, like that he has written.
Okay. Next, doctor.
Next station was a thalassemia. So that was abdominal examination. And the child was pale and he had abdominal distension. And on abdominal examination, I was able to get hepatosplenomegaly. And I told the findings to the examiner. That station went quite well, and he asked me about. He was more specific on asking me about bone marrow transplantation and its implications. So towards the discussion only, I had some issue. So that station was quite okay. He has written unsure of bone marrow transplantation and its implications in this patient.
Okay. So for management, they are cutting 1 mark or anything?
Yeah, 1 mark they have cut.
Yeah.
Then so that was that station I got only 6 marks, sir.
Okay.
Then next was spastic quadriplegia. That was okay. I did the examination. He asked me what all complications you can expect. Then what all history you want to ask specifically. I told whether he has drooling, respiratory infections, all those things, because this child was drooling heavily. And postnatal or do you want to ask any history specifically regarding the birth time or anything? So I told about asphyxia, and then that was it. So that station I got full marks, 8 marks.
Good.
Then
Others?
what's the next one?
Others? Yeah. Last station.
Last station is still a mystery for me because I can't understand what he has written also. The handwriting is not legible. I told you, so he asked me to do the musculoskeletal examination of lower limb. So the child was, I did the gait. Then that gait was kind of different. I actually missed the part where she has to sit and stand. That goers part I missed. Then I asked her to bend over. I checked the spine. Then I did the musculoskeletal examination of lower limb. Then again, I was not able to find anything particularly because only while doing the hip examination, some difficulty was there. So I told him some kind of proximal myopathy is there. Then only I thought about doing govers. Then I asked the child to get down from the bed and do govers again. That time she was not able to do the like she was climbing upon herself. So that time I told proximal myopathy. Then at that by then the time was almost over. Then before that I told I want to go with lower limb examination, a neurological examination of the lower limb. Then he told you do the upper limb musculoskeletal examination. Then I started doing musculoskeletal examination. By then the time was almost over. So so that I think it was some muscular dystrophy or something like that. I went with the diagnosis of proximal myopathy.
Okay. So there
So
was
that's
no pseudo hypertrophy was not there.
no pseudo hypertrophy was. In fact, the child was very lean with microcephaly. So I told she has a small head circumference. I would like to plot on Sendale chart like that. I told. But overall, that station is still a mystery for me. I don't know what it was, and what the examiner has written is also not very legible.
Okay.
Physical examination technique was all right. Then what all things he has written is not
Understood.
legible. That station I got actually 6. I think that was because I did the examination part. Okay. When he asked me to do the musculoskeletal examination, I did that thing properly. So I think that's why I got, because I was not able to come to a proper conclusion, diagnosis. He also asked me what specific history you would like to ask in regarding antenatal history? What do you want to ask? So I think he was expecting me to tell oligohydramnios due to myopathy. So that
Reduced
that he
movement.
asked me specifically. Yeah.
Okay. Hey, Mark, congrats,
But
Dr.
that
Kalpeni.
session I got 6 marks.
Okay.
Hmm.
Congrats, Mark. Thank you for sharing of
Yes, sir.
the
Actually, I want to
session.
thank everyone from the Smart Academy. Unless yeah, target. Yeah. Okay.
Yes.
So unless I had joined here, I would not be able to clear because I was not at all confident. Everyone here was performing so well, and that night classes. Although we all will be sleeping, almost the classes would end by 12 or 11:30 something. So I want to thank everyone for being there, even the teachers and all the other candidates as well. I was able to form a really great group from this study group.
Yeah, that networking is a big advantage actually.
Yes, sir.
Networking till the exams, that gives a lot of confidence when you know people till the exam. So I think I remember one of our candidate gave the stethoscope to one of she forgot the she became panic, and I think Dr. Vishnu Priya gave her second. She somehow she took two stethoscopes, so she gave
No,
it to her. So that was a really great thing to listen. Yeah.
yes. Yes,
So
so thank you all. Like
thank you.
all the sessions were too useful. I actually stepped into this class accidentally. Then I found it like it was a milestone for me. So thank you so much. Thank you so much.
Thank you. Thank you, Dr. Bilmina, and thank you, Dr. Pankaj, for sharing your views. Final questions we'll take up before we'll ask Dr. Gopakumar to share his stations in brief. Yeah.
Yes, sir. So my first station was development station. Development station, there was a picture, and I was asked to examine the assessment of personal and social. So history part, I took gross motor, fine motor. There was a picture of the child kept on the back side. That was a black and white picture. So when I saw the picture, I thought maybe that was not very clear. I thought maybe fetal alcohol syndrome. So I kept on asking the questions as per the format. And there is a question that sir always says you must ask. Just ask this question that is, have you given a diagnosis to your child? When I asked that question, the role player said it's Sturge-Weber syndrome. But since it was a black and white picture, that port stain was not at all seen, so I couldn't see. So then on, I understood it was Sturge-Weber syndrome, one said hemiparesis, and such and such. So there was a seizure disorder. Then it went slowly. I mean, I could complete it confidently, and assessment part was also went really well. So that was my development case. During my second last clinical case, which was the last case, second last case, when I was sitting there, the second group which had the same case, when I looked at the backside of that card which is kept there, that was a color photograph. That showed port wine stain. That was clearly visible. So had I not asked that question that Sarah's always asked to ask, that have they given you a particular diagnosis, I might have missed. So I think that saved me probably that day, and I got full marks for development.
Good.
History,
Good.
history. It was a case of poorly controlled asthma. Um, Basically, there were so many things like incorrect use of inhaler. There were pets, dogs at home, passive smoking. Shabdi sir always used to say, being a chronic disease, try to finish off the present complaints as early as possible and dwell more into the past history. So I did exactly that, and I felt both in development and history, time was not an issue. I thought I had plenty of time, because I don't know, I was relaxed. Those were my two stations, and history, I think I could complete everything. even including the pets part. When I touched upon the pets part, I felt the examiner was really happy because there were dogs at home and there were dogs were clearly attached, and the child was very much attached to the pets and all. I got full marks for history as well. Next two cases was communication. One, an ROP, extreme premature baby born to secondary to long-term infertility treatment, was on NIV, intubated NIV, now has developed ROP. Ophthalmologist has come and seen and advised laser photocoagulation. You have to communicate this to the mother. When I stepped in, I greeted the examiner, and just after I sat down, the role player, probably JR, I don't know, started crying, crying like anything. But somehow I didn't panic. I went with the flow. I allowed her to cry. As Balaji sir once said, that his mentor had asked him that if the role player starts crying, let him or her cry, and then only intervene. So I thought I will also do the same. So I tried to console her. Then I tried to address her concerns. I think it went very well, and that also went very well. I got full marks for that. Second case was a case of chronic case of thalassemia, 16-year-old girl or something. And address the concern. That was the task given. When I entered, when I asked what her concern was, that she wanted to. She's in a relationship. She is in doubt if she should disclose it to her boyfriend or not. I was not very much confident what to say, but I tried to manage. Then I tried to say something. I don't remember exactly what I told, but I was trying to address her concerns. I didn't go much into the thalassemia part, but later she asked me about the thalassemia part, and accidentally, by a slip of tongue, I told ferritin. Then she asked me what ferritin is. And then I told I explained in simple terms, but it also went very well. In the feedback form, it's written that I used jargon, probably the certain word that I used, probably. I don't know.
They are very, they will be very particular in information giving, I think, for
Yeah.
jargons.
Yes. I knew that certain word might cost me something, but anyway, I lost 1 mark in that station. Then next were two video stations. First video station was Bell's palsy. Outside information was given, just look at the video and you answer. So I was waiting patiently and entered Bell's palsy. They asked the questions from guidelines, very much straightforward questions, nothing much. I think I know I did very well. I got full marks for that. The second case, the video, again, when I sat there, look at the video and then answer the questions. There was a footnote to it. I did not read it. I mean, the first card said you look at the video and answer the questions. The second also said the same, but below there was a footnote. I forgot to read it. When I entered, it was a case of an 8 months or so of an infant with the lesions on one side, herpetic lesions, herpes basically. The footnote was it was a case of nephrotic syndrome on long-term steroids. I did not see that. I was wondering why this child should develop herpes zoster in an 8-month-old child. So when I played the video, I saw some stria or hair. Actually, it was Cushing's. I thought it was atopy. So I told atopic dermatitis, eczema, herpeticum, and some scaly lesions were also seen. But everything else was Cushing's. Then what else? What else? The examiner kept on asking. Then I said, another one differential diagnosis that I would like to consider, had this been immunocompromised, would be herpes zoster. Then he asked me, is the child not immunocompromised? I said, I'm not very sure. Then he said, it's written there. Then only I came to know that there was a footnote to it, and he showed me. Then I told him, sorry, sir, I did not read. Then he told me, no, you have to read the question fully. And I answered the questions, whatever he asked, but I lost 1 mark in that station. And it's video
So, so I think reading the station outside is
fully
very,
very
very
important.
crucial, very, very important. The stem is
Yeah.
very important. So that is a
Yes.
good take-home point.
Yes.
Yeah.
Next, last, my 4 clinical
And
stations.
this Bell's palsy, they keep repeating. So
Yes, sir. Yes,
I
sir.
also got
As sir has
Bell's palsy.
taken a revision class on videos, you said probably you will get one among this. The second might come just like that. But herpes zoster and Bell's palsy, I think sir has discussed. Only thing, I did not see that footnote, so I was a bit confused. That's all. Next, my clinical stations, that was really tough for me. First was a cardiac case. I think I went systematically. I think I got a murmur on the aortic area radiating to the carotids. Um, I told, and then I told there is no pedal edema, there is no cardiomegaly, GVP is not elevated, and no peripheral signs of infective endocarditis. But I did not say that there was no evidence of cardiac failure. So that was mentioned in the comments that I did not say so. I did not say so. And so I said aortic stenosis. And the examiner was very cool. He was very cool. He said, "What next?" Then I said I would discuss with the heart doctor, get an echo done. Then he told me the heart doctor is playing golf. What else you want to do? Patients up. I mean, he's keeping on insisting on doing something. Then I said we'll do the ECG and chest X-ray. Then he said the radiograph is on leave. Then I said I would do. Then he said the machine is complained. Then what else would you do? Then I said I would do some basic investigations like blood investigation, do a serum calcium. Then he said the hematology lab is down. Then he kept on asking what else, what else. I didn't know what he meant. I said, I'm not sure, sir. Since the patient is all right, hemodynamically and stable, I said I will try to consult the parents and wait for the consultant to come. By that time, the station got over. The comment section said my diagnosis was totally incorrect. It was not aortic stenosis. I did not mention heart failure. And I think I went systematically, but the comment said my examination was not systematic. I'm not sure about that, whether I was not systematic or not. But since I passed, I don't mind. I was awarded only 1 mark, 1 out of 8. I lost 7 marks in that station, that cardiac station. And
So,
sir.
so it should have been very difficult to recover from 1 mark.
No, sir, because since the examiner was very happy and all, I thought because I thought there was a murmur in the aortic area radiating to the carotids. So I mean, I don't know how much marks I would be awarded, but I was okay after that station. I didn't know that AS was not a diagnosis at that point, so I was okay. The second station was MSK station. MSK station, there was a kid on the court. No. Second station was GA station. GA station was basically hepatosplenomegaly with mild distress, just a mild distress. No scar, nothing. Task was to do a general examination, abdominal examination. He asked me the differential diagnosis. There was some chipmunk species, so I said hemolytic. Then he asked for the differential diagnosis. I said so many differential diagnoses, but he kept on asking why the splenomegaly. I don't know if he. But after the exam, I was discussing with one of the candidates. Suddenly, it came to mind. I never mentioned about portal hypertension. I thought I should have mentioned about portal hypertension. It kind of suddenly came to my mind. No one prompted me, but I could not bring that portal hypertension at that point of time. But I mentioned each EHPO, extrahepatic port vein obstruction, the outside obstruction, but that term of portal hypertension I did not bring. So I was not very sure. I was not happy at that station. But I was awarded full marks. I got 8 marks. I don't know how, but I got 8 marks because I gave so many differential diagnoses. I think I went systematically. I said I would finish my examination by doing such and such things. Probably that would have helped me. Even though I did not mention portal hypertension, I think that would have helped me. I was not happy after the station, but still, I grouped myself. I said maybe
So
next case.
our perception was different, right?
Yes.
Examiner had a different perception on you, and you
Yes.
had a
Totally
feeling that
different perception on
you didn't
my
do
performance.
well, and
Yes.
you went on a bit upset for the
Bit
next.
upset.
Yeah, so that
But
is a learning point also. So don't what we think may not be the true thing. The examiner
correct.
might be thinking good, and
Yes, sir. Yes, sir. I got 8 marks. I was surprised to see that I got 8 marks. Then the next station, I tried not to carry the baggage of the station to the other. I don't know if it, I mean, I never carried the baggage. Next station was MSK. There was a kid was laying on the court, mother was there. I was asked to perform a PGALS examination. And I examined in the upper limb. And when I asked the child to get down from the court, mother said, no, child is not going, child can't walk. Then I was confused. How can I do the spine examination? How can I do the lower limb examination? I was confused. Then the examiner asked me, why, what is the problem? And then I told her, the mother says the child can walk. So the examiner also was confused because they kept on changing the patient. Every two or three candidates, they kept on changing the patient. So I thought maybe this is a new patient. So maybe the child does not walk. The examiner didn't know. So I thought that would be much of an advantage for me. I don't know. And then he kept on asking questions. I kept on answering. Then, as Shabri sir always said in your rheumatology station, in addition to saying that you finished your dimensions and everything and all, height, etc., you must say about eye examination, skin, hair, and nails. I mentioned about that. And it went so. I was not sure what the examiner thought about me. After the examination, when I was discussing with someone else, that person was saying that MSK child, no, she was running around in the examination room. She was not at all standing in one place and all. Then I thought maybe some other patient. Then she showed me, do that child, that child. Then only I realized that the child was able to walk. At that particular station, when I entered, she was reluctant to get up from the bed. But I didn't know at that point of time that I thought that the child never walks. So that probably had helped me. I didn't know at that point of time. And I got 8 marks. Even though I did not do a limb examination or lower limb, a spine examination, I was awarded full marks. Then the next station was that I knew what it was. That was a spastic quadriparesis. A straightforward case. I was to asked to perform the motor system examination. I did everything in a systematic manner. There was extensive plantar, clonus, everything. He asked me what the diagnosis. I said UMN lesion and said probably central cause and so on and so on. He asked a differential diagnosis. That station was very good. I knew that I did well, but other three clinical stations, I was not sure. But I think what has helped me, I mean, in performing the last station was I did not carry the baggage of the previous bad performances. I think that helped me
Take
perform
one
well.
station at a go. So
Yes,
let's do
yes,
the best for that station. So don't
yes,
think about it's over, is over.
yes. And more than that, when I was waiting for the final station only, I saw that picture of the Sturge-Weber syndrome, that color photograph. Uh, but since I
And it's
got the
kind of
diagnosis,
strange. Usually they don't keep pictures in development. It's kind of strange that they kept a picture.
mine was a black and white photograph, and the other, that B or A, I don't remember. The other person got the color photograph. Anyway, since I asked that question, I got a diagnosis. So that's it,
So
sir.
good, good. So it's like mixed one station. You were confident in the cardiac station, right? And
Yes, but I lost 7 marks
they
there.
gave 1 mark, and you were hesitant in other, and you got full marks. So that's the
Yes,
way
yes,
our perception is different from the examiner perception.
yes, yes,
And clinical is kind of the issue is there will be patient uncertainty. So the patient will be different. They will have different findings. And the examiner uncertainty, there is no key coming from RCPCH. So whatever examiner says, so that's the say. So we have to adapt and try to score good marks in other stations so that we compensate for some uncertainty. So that is a very important thing. Yeah. So, others, any doubts you can ask the candidates? To Dr. Pankaj sir and Dr. Gop Kumar, any doubts?
One thing I want to add, sir.
Yeah.
I, two things actually. One thing, main thing, when I attended the Smart Academy program, there was one examiner. There was a face-to-face session, and one sir, while waiting for feedback, I forgot to go near him. He specifically asked where that candidate is, and when I went there, that was 1 year ago. He said, "Are you giving exam this time?" I said, "No, sir." That you don't give this time. Unless unless you are well prepared, never give. MRCPC, these people are looting money. So unless you are ready, never give. During the exam, I happened to see that person there. And I was really happy that he was at a station where I really performed well. He was not examiner,
Yeah,
but he was there.
I know, Neuro Station, no?
Yes, sir. Yes.
Dr. Prasanna sir was there.
Yes, sir. Yes, sir.
Next time he will be the examiner.
It's like a full circle for me.
Okay, so what advice you want to give to all the candidates before we close on?
Me, sir?
Yeah, what advice for the candidates so regarding they are going to go for exams, so your expertise will always help them.
I was a passive listener throughout. I prepared for 2 months. There was no specific hours that I spent over a day. Usually, people say they spend 4 hours, 6 hours per day, and all. But that usually does not work for me. There was 2 hour class, 2 to 3 hours class, 3 or 4 days a week. I used to attend that. And if at all I miss it, I used to see the recordings. But fixed hours I never used to spend, but I was consistent. Daily I used to do something. Do something. I used to listen classes. I used to read guidelines or some notes. I was consistent. It's not like any specific hours or so. And I also subscribed for past test. That also had helped me. The past test, the drawback of past test is you don't have a role player. You don't have anyone else. So this group has given me that advantage also. This target MRC PCH group. Even though I was only a passive listener, I thought this was a boost to me. And past test gave me the idea that it's not just one format that you can do on the particular day. You can do whatever way you want, but you have to do everything in a systematic way within the time frame. So that gave me an edge, gave me some more confidence, I must say. But the target group had pushed me really. And what I want to say is, as what I told earlier, it's not the amount of time that you put in, it's the quality of time. Virat Kohli has once said that a batsman hits a ball in the air and fielder is at point A and ball is coming at point B. The training will take you from A to B. But the timing of the catch, everything has to be done by the player. So at the end of the day, you have to perform. You should not carry the baggage of what has happened in the previous session. You have to have a presence of mind and you have to perform well. I think that's what matters more. Training definitely, and you must have some sort of training. That's what I feel. At least one face-to-face session would help. Thank you, sir.
Thank you. Thank you, Dr. Gupta. Thank you. And Dr. Pankaj?
Yes, sir. From my side, I would like to say that uh, most important thing that I felt is the practice. If you want to do well and want to be spontaneous, then you need to practice so that uh, it is into your spine and it will come reflexly. And the second thing is confidence. Uh, Whatever you do with confidence. Look confident, look calm, maintain your calm, and do things systematically. I mean, it should be fluent. so, so these three or four things are the most important thing. Like I felt that in that examination of MPS was quite clear. I knew that this is MPS and most likely Hunter because there was no corneal clouding. but still he commented me on DD. So I would like to say that even if you know that this is it, you should give 2 or 3 DDs, um, uh, maybe for hepatosplenomegaly, or maybe for dysmorphism, maybe for short stature, whatever, I don't know. But you should keep telling 2 or 3 DDs apart from what you are sure about. That is my take. Because when I saw MPS, I stuck to the MPS and I told only MPS, nothing else. So maybe that what examiner did not like and mentioned about that also. And there in that one more comment was there. I don't exactly remember. Needing prompts for that in that MPS station. So that was very unlike for a station which I know very well. But you need to be very confident in whatever you are presenting. If they feel that you are not confident, they will cut your mark uh, very promptly. So confidence, calm, and practice, practice, and practice.
Yeah. Thank you, Dr. Pankaj, and thank you, Dr. Gopakumar. Dr. Geetmala, ma'am,
Yes, sir.
you want to say something for candidate?
Yeah, I think all of us just need to understand that invariably, like every person's way of preparation is different. You can prepare for one day or you can prepare for 1 year. So what you have to understand is you're being judged only for one particular day that you're giving exam. So be confident, have an open mind, keep everything, your eyes, ears, all the commands listening, keep it open, never have any baggage. You'll have to have the motivation to do the best in all the station, invariably how it goes. And the best thing like we hear every time is examiners reaction is different. So some of the examiners are always smiling, like they might give you less marks. Some of them are very rude, or they might look very strict as if they are not happy with your answers. They might give full marks. So never judge. You won't be able to judge yourself in that anxious situation. So be calm, do your stations, and then forget about it until the results comes.
Thank you, ma'am. Thank you. Dr. Sabri, closing remarks.
Congratulations to all 3 of you. Yes. I think it's all your hard work at the end of the day. We are just guiding you, but it's all your hard work finally. And thank you for giving us this feedback. I think the core principles remain the same. Even though the session's same, gets different each time. The core principles are like same, like not carrying their baggage and staying calm, reading the stem again multiple times, not to miss anything. And most importantly, not to judge on our performance at the session itself. It's better to leave it. Once the session is over, I think we can go on to the next one rather than thinking about the past. I think that is repeated multiple times. Like whenever we think that we have not done good, but we get a good mark in that session. And maybe we thought we did good, we didn't get. I think this is repeating in all the feedback sessions what we get so far. So thank you all 3 of you for sharing your feedback. It must be useful to the next candidates who are going to prepare for the next session.
Thank you.
Yeah.
And my suggestion is like, yeah, it's all about practice, as everyone says. So you need to have a small group of your friends, study partners, so where you can practice. Plus, join some course, as everyone says, a course where the mentor gives you the corrective feedback. You need to know whether you are doing it the right way or not. So that is very important. And start early. So don't wait till the allotment happens. After that, you will not have much time. So keep practicing. Don't worry about allotment and all. What we can do is we can be exam ready. So rather than after allotment, because after allotment, I think hardly we will have 1.5 to 2 months only. So that's not enough. So start early, and we are starting our course from next week actually. So if anybody is interested, keen to practice with us, can always contact us. And if no other doubts, we can wind up the session. Once again, thank you, Dr. Pankaj, Dr. Gopakumar, and Dr. Belvina for sharing your insights. It will
Thank you, sir. Thank you for all
be
your
very
guidance, everyone's.
Thank you, Dr.
Thank you, sir.
Nirmalama.
Thank you all. Thank you all. Thank you, sir.
Thank
Good
you.
night. Sir. Good night.
Good night.